All right, thanks for joining. This is Dave Maddock with Maddock and Associates here to go through the 6056 reporting and tracking tool, which is the tool that will allow you to track and create the 1094C and 1095C forms that are going to be required here at the end of February. So in this presentation, explain a little bit about Maddock and Associates, who we are, how we can help you out, talk about who needs to complete this reporting, go through an overview of the 1094C and 1095C forms. Those are the forms you actually have to submit. I'm going to go through the affordability and safe harbor discussions, and then go through an in-depth example of how to use the reporting tool to generate the forms, and then talk about the deadlines and where to send the forms. So Maddock and Associates, we're your independent broker. We've been in business for over 50 years. We're here to help you out. This presentation is really focused on compliance and the reporting, but we're also here to help you out with resolving claims issues, shopping the market for you, getting you the best value for your money, for larger groups doing self-funded plans. Really just here to be your outsourced, full, all-in-one employee benefits administrator and broker. So Maddock and Dave Maddock, who I am, I've graduated from the University of Washington. Got my registered health underwriter certificate from American College, certified consumer directed healthcare consultant from United Healthcare, then also been very active in the industry, past president of Washington Association of Health Underwriters. So disclaimer, before we get into this, I need to just put out there that Maddock and Associates is not a tax accountant. We're going to be talking about IRS tax forms. And so I'm giving general information, education on how to use the tool. Each company has different facts and circumstances which may not be addressed in this presentation. And we want to make sure that everybody has their tax accountant check these forms before you submit them to the IRS. So getting into the reporting, so the way this works is all self-funded groups and groups with over 50 full-time employees in 2019 must complete the 6056 reporting. So this presentation is going to be focused on the C reports, which is for groups that have 50 or more full-time equivalent employees. There's also B reports, which are for groups that are under 50 that are on self-funded plans. We will address that in a different webinar. So this webinar is focused on the large groups. And when they're talking about 50 employees, they're talking about 50 full-time equivalent employees for 2019. So if you averaged over 50 full-time equivalent employees in 2019, then the government says you're required to offer coverage in 2020. And this presentation is talking about filing documents to verify that you offered coverage in 2020. Or if you did not offer coverage in 2020, you still need to file all these forms and just show that you did not offer coverage. The two different forms that we'll be completing is the 1094 and 1095C forms. 1094 is a summary report, just one per company generally. And 1095 is a report that goes to every single employee as well as the IRS. Down here, we've got the deadline. So they extended the deadline again every year. Luckily, they've been extending these deadlines. So the deadline to get these forms to the employees is March 2nd, 2021. That was extended from January 31st. So you might see some information floating around saying it's January 31st, but it is now March 2nd. And the deadline to get the forms to the IRS is March 1st. You may see February 28th, that's a Sunday. So March 1st is going to be the actual deadline on that. I always recommend not pushing it till the very last day. If you're filing the forms electronically, and that's required for groups over 250 forms. If you're under 250s, it's optional. What we'll be talking about in this presentation is doing it with paper. So if you're doing it with paper, that's March 1st is that deadline. If you're doing it electronically, they give you an extra month, March 31st. So question is, are you over or under 50 employees? We've got if you're right on the edge, let us know. We've got a really nice tool where you can put in every employee for every single month, their hours, and just calculate it exactly. In this presentation, I'm going to go over a quick example of just, an easy way to calculate the employees count, whether you're over or under 50. So what you need to do is for each month of the year, you can pick one day of the month or like the first payroll, or pick one thing. So for each day in the month, count the full-time employees, and a full-time employee is employees working over 30 hours a week. So every full-time employee, if they work over 30 hours a week, that's just one employee. You don't have to worry about if they work 35 or 40 hours. First step is just count those full-time employees. Then all the employees that work under 30 hours a week, they're called full-time equivalents. What you do for those employees is you add all their hours up and you divide by 120. So you have your full-time count plus your full-time equivalent. That's all the hours of the part-time people divided by 120. And that gives you your count for the month. And then what you do is you just do that for every single month, and you divide by 12. And if you're over 50, that means you're an applicable large employer and you have to do the reporting. If you're under 50, then you don't have to do the reporting. If you're under 50, you want to keep records that you've tracked, particularly if you have over 50 on payroll, but then this calculation puts you under 50. It's a good idea to really have solid records, and maybe even have your accountant verify that you don't need to do the reporting. If you have under 50 on payroll, then it's a no-brainer. Obviously, you're not over 50, but we have many groups that have like 60, 65 employees, but a lot of them are part-time. So when we add them all up, they actually end up being considered under 50. So anyway, this is a quick summary of that reporting. If you need, we have a more in-depth document, or it's a spreadsheet that can calculate this down to the exact percent. Just a good notice, there's still this year another year of transition relief. So, we've been doing this filing for quite a while, but they do understand, the IRS does understand it is complicated. So what they're saying, again, is as long as you make a good faith effort to do the reporting and you meet the deadlines, then they're not going to, they're not going to hit you with penalties for failing to do this form. So if you're over 50 and you don't file, you're going to get penalized. If you do file but there's some errors, what they're saying is they're going to give you some wiggle room. They will follow up, you will have to correct it, but they won't hit you with full penalties for making small errors if you are making a good faith effort to do this. So moving on here, what I like to do is always start with the end in mind. So what this tool we're going to go through today is a tool that creates these 1094 and 1095C forms. If you have over 50 employees, let's say you have 70 employees, this tool will create 70 1095C forms. Before I get into the tool, I just like to show what the forms are so we have a better idea of what we're trying to create. So this is the 1095 form, and let's get the 1094 form as the first one. So the first part we're going to be doing the 1094 form. This is the think of it kind of as a cover sheet, one per employer generally, and you're going to just put it's all the employer information, and then you're going to tell the IRS how many of the 1095C forms are going to come along with this form. And then check if it's the authoritative transmittal. So most of the groups are just going to be doing one form, and then you have to check this box that it's the authoritative transmittal. If you are doing, if you have multiple divisions, or you have different, you're doing more than one 1094C form, which is pretty rare. If you do, though, you do need to have just one be the authoritative transmittal. And then what we're going to be doing is this group part of an aggregated group? So if you're part of a common ownership group, you have to indicate yes, and they'll show all and then you'll tie all the companies together later. And then we'll talk about this. There's a qualifying offer method. Some people will be doing that. 98% offer method is also available. It's an alternative filing method. And then you always have to sign this form. Whoever the benefit administrator is or is doing this signs that form. And then you do have to go and indicate if you offered coverage for each month, and then go through and indicate the full-time count for your group, and then your total employee count for your group. And then also if you're part of a larger aggregated group, for each month. As I mentioned, the form that we're going to do will fill this out for you. And then here we have the aggregated group. So if you're part of an aggregated group, this is where all the related companies would be listed. And then the 1095-C form is right here. And this is, you do one of these per employee. And this is where we're going to spend most of the time. But you have the employee information in part one, the employer information in part over here on the right side. The plan start month, that's new this year. That's a 12-digit number. It's the month that your plan year starts. So if you your plan normally renews like February 1, you'd put 02 there. The form that we, like I said, the spreadsheet we're going to be working on will fill this out for you. The employee age is not required unless you have an individual HRA plan, which we don't have any of our clients set up with. So basically all our clients won't fill that out. And then here is the meat of it. For each month, you have to indicate whether or not you offered coverage, what the cost was for the base plan, and the safe harbor code. So basically, if they didn't take coverage or why you didn't offer them coverage, we'll go through all of that. So essentially for, and then for self-funded companies, you have to indicate everybody in the family who and which months they were enrolled on the plan. This part 3 is not required if it's not a self-funded plan. It's just for self-funded plans. All right. So now we've kind of reviewed the forms. What we'll do now is, well, actually, I want to talk about the penalties and something that's changed. So the penalty this year for not offering coverage is $2,570 per employee. You don't have to pay it on the first 30 employees, but you know, the penalty you'll see is $2,570, and that goes up every year based on medical inflation. And then if you offer coverage but it's not considered affordable, the penalty for that is $3,860. And so that would be if you offered coverage but the an employee did not take it, went on the insurance exchange, got a subsidized plan, and it's deemed that it's not affordable, then you would have to pay a penalty of $3,860 for the year. These penalties are all prorated for the number of months that they apply. So it's not necessarily, might not be the full year for any particular penalty. And then moving on here, when we're talking about affordability, that's really important. There's these affordability safe harbors. So the way the law is written, they indicate that for the plan to be affordable, it can't be more, and when they first wrote the law, 9.5% of the employee's household income. That affordability number changes every year. For 2020, the affordability number is 9.78% of household income. An employer really has no way to know what the employee's household income is, right? You don't know if they have you might not even know if they have a spouse or not, but you know, you definitely probably don't know how much the spouse makes and so forth. So what the government has done is created some affordability safe harbors. And if you can verify that the cost for employee only coverage for the lowest cost plan is under these safe harbors, then you can deem that your plan is considered affordable, even though you don't really know what the employee's whole family situation is. So there's 3 different safe harbors. The easiest one is the federal poverty safe harbor. And if you qualify for this, this makes your reporting a lot easier. And essentially the federal poverty level in all states except for Alaska and Hawaii is $12,760. You know, the affordability on a monthly rate, that's $103.99. So if your plan is under $103.99 a month, then you can say it's affordable based on the federal poverty level, and you don't have to worry about how much the employee makes or anything like that. It's just you can just say it's affordable for anybody basically. The next one is the rate of pay safe harbor, and this is the one that we use if you are. So we always use this is in order of easiness. So if you're charging under $103.99. Use the federal poverty safe harbor level. If you're charging more than that, and keep in mind, it's not family coverage, it's just for single coverage. And if you offer more than one plan, you're looking at the lowest cost plan. So what would it cost the employee to enroll in the lowest cost plan? It doesn't matter which plan they enroll at, they're just looking at what would it cost them for the lowest cost plan. So if it would cost more than $104 roughly, then we look at the rate of pay safe harbor. And the way you calculate this one is you look at the hourly wage for the employee times 130 hours times 9.68%. So I ran an example in Washington State minimum wage in the state is $13.50. Understand in Seattle, some places it's higher, but if somebody was at your company's working was making $13.50 an hour, when we run this calculation, the cost for the lowest plan would have to be under $171 a month for it to be considered affordable. So, you know, that if you're charging under $171.63 and you're paying minimum wage, then, you know, you can easily use rate of pay safe harbor. The next one, which is a little bit more complicated, is the W-2 safe harbor. The reason we don't like using this one as much is because you don't really know what it is until the end of the year. But basically they use box 1 of W-2. And if the cost of what you're paying, what the employee pays is under 9.78% of that, you can say that it qualifies for the W-2 safe harbor. As I mentioned, we first would use the federal poverty level if it's under 103. If you can look at the lowest cost hourly worker and you're charging less than 9.78% of that hourly wage times 130, we'd say use the safe harbor. If you're charging more than that, then the W-2 would be the one that could work. The reason why W-2 could be better is because the hourly safe harbor is using 130 hours, which is, you know, if you have employees and everyone's working 40 hours a week, you know, it's going to be more than 130 hours a month. So the W-2 could actually allow you to charge them even more. When we're getting into this, we're going to be talking about something called the qualifying offer method. So if the lowest cost plan you offered was under the federal poverty level, so 103.99, and your plan offered minimum essential coverage and minimum value, which most all plans do for all 12 months of the year. So that means you had a plan for all 12 months, and you offer coverage to spouse and children, then you can use this qualifying offer method. And it just makes your life easier when you're filling out these reporting forms. Essentially, what you can do when you're offering coverage, if you're doing the qualifying offering method, all you do is you say if you offered coverage, you can just say you offered it, and you don't have to worry about reporting how much it was or what the employee did. You just said, hey, we offered coverage, it was below the federal poverty level. It makes your life easier. I'll explain how that works a little bit later. So now what we're going to do is go to the reporting tool. So in this email with this link, we've got the reporting tool. And what I did is I've started up with a fictitious company. So the way you use this tool is there's different tabs at the bottom of the Excel document. And what you can do is it's got all the instructions and everything. So you go down here, we've got the bait, and so you just kind of work from left to right. But if you scroll over, it also has all the definitions, the IRS guidance, reporting methods, and so forth. So just going to run through an example employer to show you how this works. I'll make it a little bit bigger for you. So the first part, you're going to fill out some basic information. So this first part is it's asking how many 1095-C forms you'll be filed with this. And so you may have to wait until after you're done. You know, this might be the last box you fill out because you might not know how many reports you're doing until the very end of the year. Are you a government entity? You know, that's yes or no. Are you part of an aggregated group? For this one, I put yes, just to show you how that works. Is the employer reporting on a self-insured plan? That's going to be no, unless you're self-insured. I put yes just so I could show you how that works as well. So the name of the employer, you know, you're just going to put your employer name information and then the contact, whoever's filling out this form. If you're part of an aggregated group, you would list the related companies here with their tax ID numbers. Next tab is the detailed employer information. So what you do here is indicate whether or not you're doing a qualified offer method. And so that's where if you do offer coverage to 95% of the employees, employee and family, and it's below the federal poverty level, check yes to that. And then that will make your reporting a little bit easier. If you're charging more than the federal poverty level, or you're not offering to 95% of the qualified employees, then you would say no there. B and C are not applicable this year, and D is a 98% offer method. That's another way to make your reporting a little bit simple. If you can verify that you offer coverage to 98% of everybody. Most people just check no on that one. So monthly information. So the first one is, did you offer coverage, minimum essential coverage? For most groups, you're going to check yes for all months. If you were like you started a plan mid-year, then you do no for part of the year and yes for the rest of the year. We have the two different enrollment counts for each month. It's asking you how many full-time employees. So that's the that in full-time employee count, and doesn't include people in the waiting period. And then we have the total employee counts. That's basically people on payroll. So generally you're going to have a little bit more employees than you show as the full-time count. And then this would indicate if you're part of an aggregated group, and E is no longer required. Any extra information you want about this, we've got all the definitions down here to sort of explain exactly what all these terms mean. So that's the employer information. The second part is the employee information, and this is where it gets, this is where you spend most of the time on this thing. It really helps if you're doing this throughout the year. That way at the end of the year, it's not, you don't have to play catch up. And the first thing I like to do before I get into explaining how this system works is just a simple Excel trick. Because what this is you're going to list all your employees going down, and then this scrolls to the right quite a way. And if you notice on my screen, the employees information is staying right there, even though we're moving the columns. The way to do that is you just click on this cell right by the employee's name and under the header bar here, and you click an Excel view, click freeze panes, and you'll click freeze panes. I've already got it frozen, but freeze panes, and that will make sure that the employee's name is always on the left there. You're not going to lose them, and the header will stay there. So what you're going to do is for all your employees, you're going to put down their first, last name, social security number, address, city, state, zip code, and then plan start date, start month. And this is your group's plan start month. So this group, we're saying they have a December 1 plan year. So the plan renews December 1. That's why I have 12. If your plan renews January 1, you put 01. It's a 2-digit number you're going to put there. And so instead of first names, I'm putting down, I'm just indicating like some scenarios. So the first person, and I'm kind of modeled this over the Simpsons. I'm a Simpsons fan. So this would be like Homer Simpson, but I'm putting federal poverty level. And so this is somebody that's been offered coverage all year. And if you do the qualifying offer method, so this is your, if you've checked on this employee detailed information, right here, yes, that you do meet these qualifications, then you can use this 1A code. And that means you're charging them less than $107, well, less than the federal poverty level amount. And you offer to 95% of the employees, and you're offering to spouse and family independents. So in that case, like for example, this employee, you offered them coverage all year. What you can do is you just could say, we offered them 1A. That means you offered them coverage, which is less than the federal poverty level. If you do that, then you do not have to say how much coverage was, and you do not have to indicate whether or not the employee took coverage or anything in the safe harbor codes. So in this file, there's 3 different sections for each employee. There's an offer of coverage, and that's going to be a code indicating for each month whether or not you offered them coverage. Then there's going to be the second section is the required contribution, and that's generally going to be what the cost would have been for the lowest cost plan that you offered for single coverage. Once again, if you have multiple plans, it doesn't matter about the more expensive ones. You just need to say what would it cost for a single employee to take the lowest cost plan. And for this example, it's $150 for this company. And then we have the safe harbor code section, and this is going to be codes indicating if they enrolled or not, or why you didn't offer them coverage, and so forth. This section over here, the individual HRA, that is not going to be required. So you can just leave that blank unless you have an individual HRA. And as I mentioned, we haven't had any of our clients do that. So that would be something completely different. Down here below, you're going to need to, this is where you can reference what these codes mean. So the offer of coverage codes, there's a list here. And so this is for each month, you have to indicate what you did. And so for if you do that qualifying offer, as I mentioned, you do the 1A. Otherwise, most of our clients are using either 1E, which is you offered minimum coverage to the employee and their family. Pretty much all our clients, unless they qualify for that qualifying offer, then what they're charging is under the federal poverty level and so forth. They're going to use 1E. They offer coverage to the employee and the family. A lot of clients don't pay for the family. It doesn't matter. You're just saying you offered it to them. The other one that's most common is 1H. That means you did not offer them coverage. There's a whole lot of reasons why you didn't offer them coverage. Maybe they didn't work there that month. Maybe they're part-time. Maybe they're new hire probationary period. So generally, you're going to use 1E or 1H. And then, so if I go back here, under the covered employee information. So this is Bob who quit in June, right? So what we're showing here is 1E. We offered him coverage, it's a little bit bigger for you, through June. He quit in June. Oops. And then July through the end of the year, you didn't offer him coverage, 1H. Hope that makes sense. You offered him coverage while he worked there, and when he quit, you didn't offer him coverage anymore. For Bob here, what we need to do is for each month that you offered him coverage, show what the cost would have been for him for the lowest cost premium. So we show that through June, and then he quit at the end of June. So we just leave it blank for the rest of the year because he didn't work there anymore. And since we're not using the qualifying offer method for Bob, because I just used that for the first example, but for this company, they don't qualify because they're charging $150, which is more in the federal poverty level. Then we have to complete the safe harbor section. So the safe harbor section kind of explains what happened. So you'll see here I have 2C and 2A. So what we do down here is we click down to the safe harbor codes. And these are all the different codes. So you've got the section where you indicate whether you offered coverage or not. Then you have the section where you say what the cost was. Then the safe harbor codes, it's really a lot of it's a reason to kind of an explanation for when you didn't offer coverage. So 2A, so whenever you say you didn't offer coverage, the government's thinking, okay, we might need to penalize you, but the safe harbor code would be a reason why they wouldn't penalize you. So 2A, the employee didn't work there that month. So any month you're doing 1H, you didn't offer coverage. 2A, they didn't work there. Well, then you don't have to pay the penalty, no problem. 2B, another reason why you wouldn't offer coverage is if they're not full-time. So if someone's working part-time minimum hours, you put 2B. That would be a reason why you didn't offer them coverage. 2C would be if they enrolled in coverage. So you offered coverage and they enroll. Well, that works. You put 2C. 2D would be another reason why you wouldn't offer coverage. That's because they're in their new hire waiting period. They call it the limited non-assessment period. 2E is if you're part of a union. I got an example of that, but unions are handled a little bit differently. So as long as you're paying into union dues for union insurance, then you can put 2E. And a lot of times you don't know if they have coverage or not. That's okay. As long as you're paying into union coverage, you put 2E. And then 2F, 2G, 2H, these are all what you would indicate if somebody is opting out of coverage. So if you offer them coverage and they do not enroll, then you need to verify that it was affordable. So you can easily use a W-2 safe harbor, that'd be 2F, we discussed that. Federal poverty level, that's 2G, or the rate of pay safe harbor is 2H. All right, so let's just go through these examples now. So what you do here is, so for Bob, he quit in June, but he was enrolled while he was there. So, oops, we've got here 1E. So we offered him coverage. That's what that code means. And then July he quit, so 1H. I'm sorry, he quit in June. So starting July 1H, we didn't offer him coverage. And don't worry, COBRA is not considered an offer of coverage. That's just, offer of coverage means you're willing to pay for their active employee. So, so for every month you offered him coverage, you have to put the cost down of what it would cost him. And then we have the safe harbor codes here. It says, you remember for Bob, 2C was enrolled while he was offered coverage. And then starting in July, we have 2A for the safe harbor code. And 2A means he wasn't working there. So that explains why you weren't offering coverage. All right, let's go to the next one. We've got Ned Flanders. He was hired in July. So on this one, he was hired in July, but this group, we're saying they have a waiting period. So 1H all the way through August, and then he actually was offered coverage in September. So this is a group with like a one month waiting period. So he's hired in July. He doesn't get coverage in July. He gets the first of the month following which is going to be September 1 for this employee. So he doesn't get coverage until September, and then you offered him coverage 1E starting September. And so for the cost on Ned Flanders, you leave it blank until you start offering coverage and you include it there. And then the safe harbor code. So he wasn't, you hired him in July. So January through June, 2A means you didn't offer him coverage because he didn't work there. And then in July and August, we're putting 2D. He's in the limited non-assessment period. That's why you didn't offer him coverage those 2 months. So you put 2D for the months that are in their waiting period. And then starting in September, you offered him coverage, and 2C indicated that he actually enrolled in coverage. All right. Next one, we've got Barney Gumble at The Simpsons. He's the guy that's always at the bar. Funny guy. He was hired in July, but waived coverage. Okay, so let's look at what we did him. So it's real simple. Hired in July. So just like Ned, same offer codes. Didn't offer him coverage. He was hired in July, still in the probation period, and was started offering coverage effective September. And so 1E for that. So it's same as Ned, you only show the cost for the months they were offered coverage. The codes are going to be a little bit different though. For the first 6 months, no coverage because 2A, he didn't work there. Then the next 2 months, 2D was in the waiting period. And then since Barney Gumble didn't take coverage, 2H is his safe harbor code. And if you remember, 2H means that you're verifying that you did offer him coverage and it was affordable based on his hourly wage. And so Barney's making over $350 an hour. So that means you could charge up to $170, but you're only charging $150, so it's considered affordable. All right. So I think I handled most of the examples. There'll be different months, people come and go and so forth. If somebody's part-time the entire year, they never work full-time, you do not need to include them on this report. The last one I want to show is a union employee. So this is a union employee hired in July. All right. So this is a union where the union handles the benefits. The employer does not, but the employer does pay into the union for benefits. So for the union, the way they say to offer it is that you put 1H that you did not offer coverage because the union's offering it. And then for the safe harbor code, what you do is so 1H, you're going to put 1H for the whole year, but then for the safe harbor, you have to indicate like for the first, they're hired in July. So for the first 6 months, 2A, you didn't offer them coverage because they didn't work there. But then starting in July, that's when you started paying into the union, and 2E is the code. It's saying we didn't offer him coverage, but the union, we paid into the union. So that's a code to verify the IRS that the union was responsible for that. So that's how you do this. As I mentioned, if you make sure to use that freeze frames, make sure to save this thing all the time. And then try not to mess with the formatting, as we're going to upload this later. And if you change the formatting around, sometimes upload will break. The next part is only for self-insured employers. So if you're not self-insured, you do not need to worry about this at all. If you are self-insured, then you need to go in and indicate all the employees as well as the family members. So what we have here is Homer Simpson, and what you do is you then tie the employee to themselves, and then Bart Simpson, that's his son, you tie that back to the employee, and then for each month that they're actually enrolled in coverage, you put an X in that box. So you have to go back through and for each employee indicate which months actually were enrolled in coverage. And that part maps to this section 3 here. As I mentioned, once again, if this is only for self-insured plans. If you are not self-insured, then the insurance company does a different form and gets that to the employees. So that's how you do this. You just got to go through and, you know, this is the big piece. You're going to go through every single person that worked there. As I mentioned, if they're part-time the entire year, you don't have to put them on here. But if they weren't, you put them on here. For every month, you explain whether or not you offered them coverage. If you did offer them coverage, how much it was, unless you qualify for the 1A. And then the safe harbor code is indicating, you know, reasons why you wouldn't offer them coverage, or if they enrolled, or if they didn't enroll, if it's affordable. So once you've got that complete, then what you do is you need to upload it to the MyWave Connect website. So you should have an email with a login to this. If not, just let us know. What you do, basically what you need to do is save this document to your computer somewhere. And then when you log into the MyWave Connect portal, you go to Compliance Apps. You click on, you launch the reporting tool. And then right now it's not ready to take the 2020 ones, but soon this will be updated and you can upload the 2020. You just browse to your computer to find the file. And then you'll go ahead and upload it. And then what they'll do is they'll create all the forms for you and then email you a link to download them once they're ready. If there's errors, they'll email you errors. You can call our office if you have any issues with this. We can help you out with this. Sometimes there's some troubleshooting with the file formatting and so forth, but this is something where we can help you out with. All right, moving along here. So we've gone through the reporting tool. In the email is the reporting instructions. As I mentioned, you go to the MyWave Connect website, upload the forms, and then you need to mail out the forms. So you need to mail the 1095C to every single employee no later than March 2nd. And then you have to send the 1094C with the 1095C to the IRS no later than March 1st. We've got the IRS website here. That's also in the instructions. All right, well, now you've gone through the training for the 2020 6056 reporting. I hope that is good information for you. Any questions, give us a call, 800-875-4490. Good luck, and look forward to helping you as you go through this.